Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic in our country, in Maryland, and here at GBMC. So again, the news is good. The test positivity rate in Maryland is down to 3.28. You'll recall that the CDC looks for local positivity rates below 5 to believe that restriction tightening is not required. This statistic goes with the Maryland hospitalization of coronavirus patients. This morning, we had 856 people in the 43 Maryland acute hospitals who were there because of the coronavirus. That is the lowest it has been since early November. Here at GBMC, we are also doing well. We are down to 20 coronavirus patients in GBMC, and none of those are requiring a ventilator. There's good news on the vaccine horizon. I'm sure you've heard by now that Johnson & Johnson has acquired emergency use authorization from the FDA for their vaccine, and they are sending doses now out to the 50 states. A word of caution that Johnson & Johnson is sending everything that they've already made, and there will be now a lag as they speed up production to get a second distribution of their vaccines. You may have also seen on the news that Merck will be working with them to help produce that vaccine. So we will now have 3 authorized vaccines that can be used to get the rest of the public vaccinated. Also in the news, President Biden has announced that their calculations now show that by May, there will be enough vaccine out there to immunize all U.S. adults who want to be immunized. So the news is good. We cannot, though, let our guard down yet. We must continue to wear our masks, use proper hand hygiene, and stay socially distant when we can. By maintaining our watch against the virus, we will get this over the finish line. It is clear that as Americans are getting vaccinated, the risk of disease is dropping. So hang in there. I think in a couple of months, you will see that we can start relaxing these restrictions and get back to closer to what we recognize as a normal life. I also believe that because of the data on influenza showing very, very low rates of influenza disease in adults and children, we will be using masks into the future as a technique to reduce the spread of all respiratory tract viruses. I think we will do that by choice because we know that in peak viral season, it's a good way to prevent you from getting a bad cold and maybe worse if you are chronically ill. So again, I want to thank all healthcare professionals, especially at GBMC, but also across the state and across the world for that matter, for standing up against the virus. I want to thank you, the community members, for your great work in the Big Four, wearing your mask, washing your hands, staying socially distant, and taking a vaccine when it is available for you, and there are more on the way. I also want to thank everybody for coming back to GBMC for needed care. We were very concerned at the height of the pandemic about people foregoing, among other things, colon cancer screening, which, as I've said to you in past updates, saves lives. but you are now coming back for your colon cancer screening as appropriate. And that's a great move, and we are very thankful that you are doing that. So again, stay safe, and look forward to seeing you if you need help at GBMC.